GLP-1s on the whole are a longevity tool, but not necessarily for these secret longevity effects that some people think that they may have. Metabolic health is the biggest health crisis in the United States. I mean, that is the source of all of our unnecessary death risk. Anything that improves metabolic health is going to improve our longevity, our lifespan, our health span, our disease risk. That is primarily where GLP-1s derive all their benefit, is in the ability to reduce appetite and food noise enough so that people stop poisoning themselves with food and the system gets better. Blood sugar control gets better. People have less visceral fat. Their blood sugar, their insulin sensitivity improves. There is just more studies after more studies showing this immense benefit in reduction of heart attacks, in strokes, in dementia, in breast cancer. I mean, the list keeps going on and on. This is almost all from the improvement in metabolic health. That's primarily how I think about GLP-1s. There is question on whether there is longevity benefit from GLP-1s above and beyond the weight loss, above and beyond the metabolic health improvement. And I think it's a great question. I don't think the data is completely clear to show that there's this kind of magical benefit that is just going to extend your lifespan for an otherwise healthy person. It does seem to show that there's some reduction in inflammation and potentially some benefits that we're not even aware of there. But first and foremost, when I'm determining if a GLP-1 is right for somebody, the first question I'm asking, is there signs of metabolic dysfunction, problems with regulating your blood sugar, insulin resistance, or excess weight, visceral fat, etc. So the first thing, like the first things that we assess when somebody's already on a GLP-1, body composition and blood work are the two biggest. I want to see those pretty much immediately. It'd be lovely if we had a DEXA scan, a good sense of their body composition prior to starting the GLP-1. That'd be great. But at least being able to assess their muscle mass, their visceral fat, the fat mass on their body, because those are going to be some key metrics that we need to keep watching over time as they continue to use a GLP-1. I think it's important to understand where the baseline is right then, that snapshot of their blood sugar control, of their insulin sensitivity, of their cholesterol, of their inflammation numbers. It's good to check these enzymes from the pancreas from time to time to make sure that the GLP-1s aren't causing any issues there. But those are the biggest things to understand in somebody because those are the things that we're using the drug for. Those are the things we're trying to improve. We have to know what those are because those are the primary endpoints. That's why we're doing this, and that's how we know if we're doing it right. Some critics say that GLP-1s are a shortcut. I don't know. I mean, is it entirely wrong? No. Look, I think when there is a fire in your house, you put it out. And some level of metabolic dysfunction that you achieve, it becomes a fire at that point. This is usually somebody in their 30s, 40s, 50s, and above. And so they've had plenty of their life to try to improve this before and maybe weren't able to achieve it. And because it's a shortcut, we're not supposed to take it to improve their health and their risk. Kind of bad point on him or any critic from that angle. But that being said, definitely, I mean, it's not more than 50% of the people in our clinic that are taking GLP-1s. Some people really do understand that there is room for improvement in their exercise and their nutrition and their discipline, and they take pride in the fact of being able to achieve that without a GLP-1. Now, I am always encouraging of this, of course, because I mean, what's the worst that's going to happen? They're going to put these best practices into their life and benefit long term from those, of course. And some people, some people achieve that. Like it's people have been doing that since well before GLP-1s. Now, also, if if they are able to instill these practices and still not get the level of improvement in both body composition or their metabolic health, then these tools, these GLP-1s come in quite handy. When somebody has the right routines where they're eating enough protein, where they're doing strength training and they're doing enough exercise, then all of this stuff really looks a lot better. It's kind of the way to do it right.